Many people unknowingly perform exercises every day that seem harmless on the surface, but are actually wearing down their joints, especially after age 40. Without proper guidance, these movements gradually damage the knees and compress the spine. At first, it may just feel like a small pop or a minor ache, but over time, these warning signs turn into real limitations, affecting not just your workouts, but even basic daily activities. That's why today, we're diving into 10 of the most harmful exercises for your knees and spine once you're past 40. Stay tuned, especially for number 5, widely considered the most dangerous on the list. Exercise number 10, leg press machine. The problem starts when people load the machine with too much weight and bring their knees too close to the chest. This creates massive compression forces on the knee joint, particularly the patellofemoral joint, where the kneecap meets the thigh bone. The deeper you go, the greater the pressure, and that stress adds up over time. Another common mistake is locking the knees at the top of the movement. When you do this, instead of the muscles absorbing the force, it gets transferred to the ligaments and tendons, structures that, after 40, are far less elastic than they once were. This can lead to injuries like meniscus tears or damage to the anterior cruciate ligament. And the spine, it suffers too. As you lower the weight, your lower back tends to lift off the seat, exaggerating the lumbar curve. This compresses the discs in your spine, increasing the risk of herniation. Exercise number 9, traditional sit-ups. Lying on the floor with your hands behind your head, curling up and down. It's one of the most common ab exercises out there, but traditional sit-ups can silently wreak havoc on your spine, especially your lower back. Every time you crunch up, you're compressing your lumbar discs. This repetitive force pushes the discs backward in an uneven manner, which can eventually lead to herniated discs. And after 40, when those discs naturally start losing hydration and cushioning ability, the risk skyrockets. There's also a tendency to yank the neck forward with the hands, placing undue strain on the cervical spine. Over time, this can cause chronic neck pain or even disc degeneration in that region. Worse yet, traditional sit-ups mostly work the superficial ab muscles, neglecting the deeper core stabilizers that actually support your spine. Exercise number 8, barbell bench press. This classic chest-building exercise is a gym favorite, but not exactly shoulder-friendly, especially after 40. The bar locks your arms into a fixed path that may not align with your individual shoulder mechanics. Over time, this can aggravate the rotator cuff tendons, which are already more fragile with age. When the elbows drop below chest level, the torque on your shoulder joints increases significantly, risking inflammation and long-term damage. Add in the habit of arching the lower back excessively for more leverage, and you've got a recipe for both shoulder and spinal trouble. Exercise number 7, dumbbell chest flies. While flies may look like a great way to target the chest, they can place your shoulders in a highly vulnerable position. As you lower the weights with outstretched arms, you're putting immense leverage on the shoulder joint, especially where the upper arm connects to the shoulder blade. This stretches the ligaments and tendons to their limit, especially when the elbows are almost straight. Going too low increases the tension on the shoulder capsule and rotator cuff, risking chronic instability or tendinitis. And if you arch your back to compensate for the weight, you're adding unnecessary pressure to your lower spine. Exercise number 6, behind the neck shoulder press. Once a popular move, the behind the neck press is now widely recognized as a joint killer, especially for anyone over 40. Lowering a barbell behind your head forces the shoulders into extreme external rotation and abduction. That means the joint is pushed to the edge of its natural range, compressing the space where key tendons, like the supraspinatus, pass through. This can trigger impingement syndrome, where inflamed tendons rub painfully inside a narrow joint space. To make matters worse, the neck often gets forced into an awkward extended position to clear the bar, placing dangerous stress on the cervical spine. Exercise number 5, front dumbbell raises. This move isolates the front deltoid, but it does so at a cost. Lifting weight straight out in front of you shifts the load directly onto the shoulder joint and the biceps tendon. When performed with poor form or too much weight, the imbalance it creates in the shoulder muscles can alter joint mechanics. Over time, that imbalance leads to pain, instability, and possible injury. Many lifters also use momentum, swinging the body or arching the back, to complete the reps, which sends unnecessary force into the neck and lower spine. Exercise number 4, diamond push-ups. This variation of the push-up, where your hands form a diamond shape under your chest, is tough on the triceps, but even tougher on your joints. It forces your wrists into an unnatural angle, compressing nerves and increasing the risk of conditions like carpal tunnel syndrome. The elbows also endure high levels of stress due to the narrow hand placement, potentially leading to tendonitis or bursitis. And because the shoulders are rotated inward during the movement, the rotator cuff is placed in a vulnerable position, particularly for aging joints. Exercise number 3. Behind the neck lat pull down. In this variation, you pull the bar down behind your neck, forcing your shoulders into excessive external rotation and extension. This compresses the space in the shoulder joint and grinds down on key tendons. It also requires the neck to jut forward awkwardly, which can compress the cervical spine and irritate spinal nerves. Over time, this position wears down the discs in the neck and may even lead to herniation. Worse still, people often arch their lower back excessively to compensate for tight shoulders, which shifts dangerous pressure to the lumbar spine. Exercise number 2, conventional deadlift. The deadlift is one of the most effective full-body lifts, but also one of the riskiest, particularly for the spine after 40. Lifting heavy weight from the floor places massive compressive forces on the lower back. If your form isn't flawless, or if you lack the hip mobility to keep your spine neutral, the lumbar discs take the brunt of the stress. And as we age, those discs become more brittle and less shock absorbent, making injury far more likely. Knees can also suffer if lifters attempt heavy weights without proper control, potentially overloading the ligaments and tendons. Exercise number 1, Smith machine squats. The Smith machine looks safe because the bar moves on a fixed track, but that track may not match your body's natural movement patterns. By forcing a vertical path, it often pushes your feet forward and your back into a more horizontal angle, which increases spinal flexion. This puts enormous strain on the lumbar discs, especially dangerous for aging spines. The guided bar also reduces the activation of stabilizer muscles, leaving your joints more vulnerable during heavy lifts. And because the machine locks you into one position, it may overload the knees, particularly at the patellofemoral joint. This isn't about quitting strength training. In fact, resistance training becomes even more essential as we age. For joint health, bone density, and muscle preservation, the key is training smart. The exercises listed above aren't bad in every context, but they come with higher risks as the body ages. Luckily, there are alternative exercises on my channel that won't harm your health. I recommend checking out the description and playlist.